Namaste. We are Narayanan and Padmavati Komarath. Our aim is that every person, at least in India, must have affordable and ready access to the very best wellness advice and healthcare. The Ayurveda clinic is a very special resource, underappreciated in our opinion. Today's BA-MS graduate, Bachelor of Ayurvedic Medicine and Science, graduate is steeped in traditional medicine, but is also knowledgeable about allopathy. They can tell you what the allopathy doctor is going to tell you. Most of all, she, and I use the pronoun she to refer to everybody. She is accessible, speaks the language, is part of the community, and can guide when a referral is needed to specialized care. The other aspect is telemedicine. India has fabulous connectivity. Our concept is to tie these with the Ayurveda clinic as the first point of contact. It is not replacing allopathy or anything like that. It is the first point of contact. With diagnostics for most routine tests and telemedicine to connect with the best care available anywhere without stressing the patient and their relatives, with the trouble and expense of shuttling between crowded urban-based hospitals and unfamiliar environments. To reiterate, the aim is to reach everyone, first with wellness guidance and then with healthcare at sustainable cost. The past or usual system is for every patient to travel to these mega hospitals, that's the fashion, in urban centers to get any help. Massive suffering and enormous expense. In our system, everyone first goes to the local Ayurveda clinic, easily accessible, gets most of the diagnosis, even telemedicine consultation with hospital specialists, and then only when needed. And of course, there will be cases where that is the only way, has to go to a hospital. In 2021 IEEE conference in Mauritius, we presented the concept. At WAVES 2024, we presented a pilot project focused on one state. Now we are presenting two actual case studies from the patient's perspective, not the medical specialist perspective. So don't be surprised. I don't have medical jargon and Greek letters to throw at you. It is from the patient's perspective. You may not like some things, you may like some things, but this is what it is. So we want to emphasize that this is not an either-or model. It is collaborative. The only thing really important is the patient's health, well-being, physical, mental, economic. Retain accurate records available to all entities, not located at some central research database that no one can find when needed. Use the lessons, continuous learning in research and development to keep improving. So case one is a 70-year-old man, 25 years of battling type 2 diabetes, with the best medical care available in the USA, mind you, and from people who actually knew the Indian system very well, really the best. Returned to India circa 2022, and in 2024 decided to seek help from Ayurveda. The reasons are given here. He was losing the war. Diabetes was winning. But for the past 2 years, he has kept his A1C managed very much under control with minimal medication. The medication has been reduced steadily. So here, Ayurveda, the Vaidya at the Ayurvedic clinic, took the time to understand the case history. The CGM sensor, the continuous glucose monitoring sensor, was an enabling diagnostic. No doubt about it. It removed the guesswork. Telemedicine was not involved, but the Ayurveda collaborated with local allopathy physicians to verify her diagnosis and get prescriptions filled. Case two is a 70-year-old lady. She had laser cataract surgery in the USA. Again, the best possible medical care in 2019, mid-2019. By 2022, she needed 1.5 power reading glasses, just like I am wearing now. But by 2024, she was complaining about a film in front of one eye. Routine eye checkups at the local eye hospital showed nothing. But then she insisted and went for a full retina scan, and they found fluid accumulation behind the eye, at the back of the eye. It indicated an injection with a semi-experimental drug into the eye, etc. Also quite expensive. Fortunately, they were able to send the eye scan results over the internet to a very senior professor of ophthalmology at a major Indian urban hospital, hundreds of kilometers away. He agreed with the diagnosis, but he warned that he was not optimistic about that injection treatment. It really wasn't going to provide a stable cure. It would have to go back again and again. It would have to be repeated. So wait for some time. If you have access to Ayurvedic approach, try that and then go for a second eye scan after a month or two. Ayurveda eye specialist visited the clinic and he did his diagnosis. Then they started a 1 week dhara, that is a continuous pouring of medicated water for an hour over the eyes every day, plus eye drops and medicated eye wash at home. After a month, or actually closer to 2 months, because she didn't have the complaint anymore, she went back for another eye scan. Different eye clinic did not tell the history why they were there. They asked, why are you here? Well, they found the place. I mean, they could locate the place where there had been a fluid accumulation, but now it was nearly gone. The patient's complaint was also not there. And in the years since, she has been quite okay. So in this case, Ayurveda guided the patient through hospital diagnostics. The diagnostic results were transmitted over the internet to a specialist far away, one of the best in the world. Ayurveda treatment was followed by another diagnostic. Again, the result was sent to the same expert for verification. The Ayurveda coordinated all this. So the role of modern diagnostics is very important here. Many basic diagnostics are already available at the Ayurveda clinic. The Vaidya reads up very much and is very familiar with computer, cell phones and social media and so forth. So she's not an ancient person. If an affordable continuous glucose monitoring system were available for patients in India, and today that is not the case, it's very, very expensive, that will be a huge revolution in Indian healthcare, since so many people suffer from diabetes, particularly type 2 diabetes. In fact, a relative of patient 1 was given the CGM. It helped her to stop insulin injections. This is something well beyond what the Ayurveda was optimistic about. She had said, well, we'll try, but it hasn't worked in the past with people who are already using insulin. This patient uses yoga, diet, and Ayurveda medication instead. Now we get to the obstacles to scaling up our system. The Ayurveda clinic cannot do any form of surgical interventions because they're not allowed to administer anesthesia. If a qualified anesthesiologist could at least be on call, available on call, they could benefit greatly. The Ayurveda is prohibited from writing any sort of prescriptions for allopathic medication. But they can get collaboration from an allopathy specialist who can verify the diagnosis and need for it and write the prescription. There are all sorts of other obstacles which I consider to be petty obstacles. But one has to remember that one of the strong reasons, before jumping into huge revolutionizing Ayurveda, one has to remember that why dedicated Vaidyas went to learn Ayurveda in the first place. They want to focus on patient well-being, not be bothered too much by the money pressures of allopathy. And again, don't take this as some attack on allopathy. It's the blunt truth. So our conclusions: this ALDT, Ayurveda Led Diagnostic Telemedicine, can remove most of the need for people to lose wages and travel and hang around at the distant urban hospitals, strange environment with expensive stays to care for loved ones for most things. Some things, of course, are essential. The clinic must have very reliable and effective top-class internet connectivity. But that today is so easy. Advanced diagnostics can and should be provided to the clinics, and training if necessary, and research to make CGMs particularly available cheaper should be a priority. A solution must be found to the problem of anesthesia at clinics. Finally, government, I hope, must take this seriously and at the highest level should both encourage the communities, all communities, and remove the obstacles, enforce common sense if needed. The capability is present, but the will to implement is essential. And here are further resources, links to the paper in draft form and to our prior work. Thank you. And